Hello, my friends, and welcome to the Pathway channel. Today, I will discuss with you the urothelial carcinomas, and I will show you two patients, one with carcinoma in situ and the other one with high-grade urothelial carcinoma. I will first start by the WHO classification for these tumors. It's under the tumors of the urinary tract, and we have either the urothelial or squamous. Today, we'll speak about the urothelial and others. But today we'll speak about the urothelial carcinomas, and it's subclassified into either non-invasive or invasive. The non-invasive, this is the slide for the non-invasive, which is the carcinoma in situ. And to just describe this slide, you can see here that we have some atypical cells from the low power. We are actually on the 20x, so we can find that we have these cluster of cells that are showing some overlapping of the nuclei. They have large nuclei in comparison to the normal urothelial benign cell. They have also some prominent nuclei, which we will see under high power, but even from this power, we can appreciate here one prominent nucleoli. And yeah, so as we mentioned, nuclear enlargement, marked pleomorphism, as you can see between the sizes and the prominent nuclei. Let's go on a high power. So this is the high power for the same patient. As you can see, it's not invading into the lamina propria. It's just confined to this mucosa. So it's very important to identify the extent of invasion in the urothelial carcinomas. But in this specimen, we just have limited section, so we don't see the muscularis propria. And from this section also, we can see that it's not invading into the lamina propria. So again, with the high power, we have the nuclear pleomorphism. See this very large nucleus in comparison to this one. And it's a bit eosinophilic cytoplasm and this prominent nucleoli, and also the crowding or the nuclear overlapping. So this is the carcinoma in situ, and this was diagnosed as urinary bladder carcinoma in situ. For comparison, I got you this slide. We are at 10x, and this is a high-grade urothelial carcinoma. And you can find on these kind of specimens a lot of cautery artifact, but I just want you to appreciate here that we have fibrovascular cores, as you can see, full of blood vessels. And these fibrovascular cores, they are covered by urothelium. But this urothelium has other features. It's very thick, and it has this nuclear atypia. So you can see that we have pleomorphism, marked pleomorphism, and we have some overlapping. And I will show you this also under high power. So from this, we are at the 20x. I just want you to appreciate again the fibrovascular core that is present and how thick is the urothelium. And this urothelium is not a normal urothelium. You have here very big nuclei compared to this small one. So we have prominent or marked pleomorphism. And you can see these cells, they have loss of polarity. They are arranged in a haphazard way. So these are all features of malignancy or high-grade malignancy. I want you to appreciate also whether this tumor is invading into the lamina propria or whether it's reaching the muscularis propria or not. So I will get this on another slide for the same patient. But again here, this is a beautiful fibrovascular core, and it's all lined by this atypical urothelial cells or malignant urothelial cells having the same features as we mentioned before. Okay, we mentioned also that it's important to identify whether this tumor is invading the wall and to what extent the invasion. So this one, you can appreciate here that we have these thick muscle bundles. So this is the Muscularis Propion of the urinary bladder. And as you can see, the tumor cells, they are infiltrating between these muscle bundles. So this is, of course, infiltrating and reaching the Muscularis Propion. And this will, of course, upgrade the stage. I will go on high power to see these cells. So again, here we are at the 20x, and you can see these muscle bundles. And in between, you will see this ugly cells or nuclei, which belongs to the tumor itself. So this is high grade. We diagnosed this case as high-grade urothelial carcinoma invading the Muscularis Propion. And this is another low-power picture from the same patient to show you the thickness of the urothelium and the fibrovascular course. Thank you for watching the video, and if you liked it, please subscribe to our channel.